Hi, this is Dr. Karen Nagelkirk, and in my 30 years of providing audiology and hearing aid services in West Michigan, I find there are a lot of questions clients have that they have trouble finding the answers to. This video series, Sound Hearing Advice, was developed to help you get the answers you deserve. Today's question is, how can I tell if I have had some hearing changes? Signs of hearing loss can be subtle and they can emerge very, very slowly, or they can be very significant and come on suddenly. Either way, there are some common indications. You should suspect some hearing changes if you require frequent repetitions, if you have difficulty following conversations involving more than two people, if you think that other people sound muffled or like they're mumbling. That's a good one. Have difficulty hearing in noisy situations like conferences, restaurants, malls, or crowded meeting rooms, or like the narthex in church. If you have trouble hearing children and women. If you have your TV or radio turned up to a higher volume than what everybody else likes in the room. If you answer or respond inappropriately in conversations. If you have ringing in your ears. Or if you find yourself watching people's faces when they speak with you more intently than you used to. You also may be able to tell if there's some hearing changes if you feel stressed out from straining to hear about what others are saying. If you feel annoyed at other people because you can't hear or understand them. You may feel embarrassed to meet new people, or from misunderstanding what they're saying, or not getting their name right. You may feel nervous about trying to hear and understand overall. You may find yourself withdrawing from social situations that you once enjoyed because of difficulty hearing. And that's a hard one because you don't always know that it's hearing. It's happened so gradually. You also need to watch out for changes medically. For instance, if you have a family history of hearing loss, if you take medications that can harm the hearing system, like ototoxic drugs, drugs that will hurt your ear but help, say, your kidneys. If you have diabetes, heart, circulation, or thyroid problems. If you've been exposed to very loud sounds over a long period, or a single exposure like a gunshot to explosive noise. If you have experienced any of these symptoms, have your hearing checked, and by that I mean get a full diagnostic examination to assess your hearing status so that we can rule out any problems that you may be having. I have to thank Patricia Conley, a PhD from the New Jersey Medical School in Newark, New Jersey, for the appropriate list of indications for hearing changes, and I want to thank her for that. That's our sound advice for today. We welcome your questions and are eager to solve your problems caused by hearing changes. You can get instant access to other videos like this on our YouTube channel, youtube.com/VanDoorneHearingCare, or by visiting our website at VanDoorneHearingCare.com. The best thing to do is to call and schedule an appointment at our office so we can evaluate your individual situation and assess your current hearing needs. Until next time, this is Dr. Karen.